Northfield Health Centre. Can I help?
It's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
What are you worried it might be?
Skin cancer.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot.
I fell onto my head.
Right.
I was paralysed neck down. My ankle went up. I heard it crunch and pop and...
We need you in the NHS for a long time, so we need to look after you.
Health Centre, can I help you?
Georgie.
Oh, we're seeing this doctor.
Hi.
Hello.
Come on in. Have a seat. So what's been going on?
She's been getting a lot of nosebleeds, but coming from just this side of the nose, but she's getting a lot of them in school.
Oh, right.
The first aider said to me today it's going on bleeding for at least 5 to 10 minutes.
OK. How often are they coming then?
She could at least have 3 or 4 a week.
Right. And how long's that been for?
Like the last 2-3 months.
OK.
One week when we was in school, she had quite a big one, they couldn't stop it.
Right.
And she said to me, well, if I was you, get her checked, because she could have a blood vessel or something like that.
Yeah, well, it's definitely a burst blood vessel, because that's what's causing all of the bleeding. Should we have a little look and see what's going on? But there's nothing, you're not feeling unwell with it or anything like that? No.
Hello.
Hi.
Have a seat.
Thanks.
Right, what can I do for Hugo?
His eyes, I've been a few times.
Right.
And I've been to see the health visitor as well.
Yeah.
And I'm getting a lot of conflicting messages.
Right.
Every time I come here, the GP's told me that it's kind of normal for his eyes to be this sticky.
Yeah.
The health visitor told me it's not, it's definitely an infection.
Right.
And it's just when he's waking up from nap.
Yeah.
And in the morning, he can't open his eyes.
So have we tried any antibiotic drops?
No.
No, I think that's what we need to do.
Yeah, okay.
So the thing I think that we're probably not passing on to you is that he's got conjunctivitis, it's obvious, isn't it? And it's a bacterial conjunctivitis.
Yeah, because this, I cleaned it before we left the house about 10 minutes ago.
I think the thing is, often it clears up on its own over a few days with just wiping it. But if it hasn't, you need antibiotics. How long has it been there for?
5 months, probably.
And we haven't used antibiotics?
Once when he was about 2 weeks old.
Right, OK. So let's try them again.
Yeah,
OK, if it doesn't settle, then come back and see us, OK?
I've just been feeling so frustrated every time I come. I'm just like, my baby's got sore eyes and it's just like, I'm having to open his eyes up for him every time he has a nap.
Oh, bless him. Yep, so 4 times a day. OK, be careful to wash your hands and everything because it is quite infectious. Give it a week, 10 days. If it's not clearing up, come back.
Yeah.
OK?
Oh, thank you. Hugo, sort your eyes out. You'll be able to see again.
OK.
Thank you so much.
No problem. Pizzaurus Rec, eh? That's fantastic. OK.
Thanks.
Bye-bye, sweetheart. He's gorgeous.
Just look up for me. Oh, yeah. Is it itchy?
No.
And this one's OK?
Yeah, that one's fine.
Yeah. And this is the only place that you're bleeding? You don't get any bleeding anywhere else?
No, nothing. Just
no other bruises to see or anything else?
No.
Because it's really common to get nosebleeds. And what I can see up your nose is that there's a little area, which is the place that you get nosebleeds from, that's got a little bit of a crust over it, and that's where your nose is bleeding from. And mostly, if we give you some cream, that will settle it down, because often what happens is you get a bit of an infection there, and it stops the nose blood vessel from healing up very well, and that's why it keeps bleeding, all right? And it's not a serious medical problem, it's just that you've got nosebleeds. And as long as you're not feeling really dreadful and unwell, then that's all that we need to do. The most important message is to learn how to stop them. because there should never be a kind of nosebleed that you want to, you don't want that to carry on for you.
She panics, and of course she was panicking and made me panic.
And that's part of the problem often.
Yeah.
So you need to learn how to stop them on your own, okay? And the way to stop them is to get your finger and thumb like this. You put your nose right in the middle and grip really tight. Now, often people say grip here.
Nose.
Means no difference, because that's just bone up there and hard cartilage, so you can't do anything there. And sometimes people say, put your head back. Don't do that either, because then the blood all just runs down the back. You need to hold it like this, but really grip tight. And then you need to hold it for 10 full minutes. And then 99% of the time, that will have stopped all the bleeding. And obviously, if it carries on after that, then try it again. But if it doesn't stop after that, then you need to go and see somebody, because then it's really not stopping. But the major problem is that you don't press for long enough.
Press for long enough.
All right? And then if this isn't working, then we'll see you again, just to follow it up. All right? Cheers, then.
Lovely, thank you.
Bye.
Bye.
Firstly, how are you?
Terrible for the last couple of days, to be honest.
Right, what's been happening?
Feel tight around the chest all the time. Slightest exertion, I'm breathless. But I keep going and it sort of diminishes a bit and I can get over it. And then sleeping, lie down, I feel as though I'm suffocating. I sort of get a panic attack, start breathing again, and I found it better last couple of nights, basically sitting up, trying to sleep.
Right. Over what period of time do you think this has happened?
This last bit now is about 3 or 4 days, isn't it?
Yeah, it's over the really hot weather, and his feet are very swollen.
Yeah, they've never been like that before.
No, so this has happened over the last 3-4 days.
Yeah.
Your ankles have swollen up, but more importantly, you're getting more short of breath when you do something.
Yeah, it might be coincidence. It seems since I've been taking the beta blockers that it sort of pronounced it more, if you like.
But you're getting chest tightness, are you?
Feels like I've been sort of squashed a bit.
And that's for how long?
Only seconds.
And how do you think Alan's been?
Constantly sleeping. If he sits on a flat surface, he's asleep. And he does this regularly.
Okay.
And I can be talking to him like I am you. We're having a conversation, he just closes his eyes. And then wakes up 3 or 4 minutes later, has no recollection of the conversation we've had, which was symptomatic of last time before he had his heart operation. Actually, he used to do that quite regularly.
Hi.
Hi.
What's been going on?
I fell down a rabbit hole.
Oh, dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better, and I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
OK.
So I think there is some...
And were you able to walk on it at the time?
Oh, well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just kind of
through
got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
About 7 weeks ago.
7 weeks ago.
Yeah.
So what's brought you up tonight then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
OK.
So I just wanted to check before I went.
Yeah, because I think, if you did sprain your ankle,
Yeah.
which is what probably has happened, then it does often take months to get better.
Yeah.
Is it sore at all?
Yeah,
Not-
it's more here.
Not round the back, though.
No.
Move it round and round.
It's there.
This is where it's sore, yeah.
Yeah.
That's where it's painful. Because that's the classic spot where you get a sprained
Yeah.
ankle.
Ah, I
Is
can't
it
do
sore
that.
on your foot itself?
No, it's there. I'm gonna bend it.
What about
up.
in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there?
Yeah.
It's more in the over the foot?
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some?
Yeah. Is that just any day?
Yeah, 9 till 5,
Friday.
Monday to Friday,
9 to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the result?
Yes.
All right.
Thank you so much.
Cheers then.
Bye.
Hopefully it will just,
Oh, I
there won't be
think
anything
so.
there, but if there is,
Yeah.
then we'll do something more about it.
Thank you very much.
OK, bye.
Bye.
Do you ever feel as if your heart's jumping beats?
Not really, no.
No. OK, fine. So it'd be good to have a listen to your chest and heart as well, if that's OK.
Yeah.
So we just pop onto the couch here. Nice breath through the open mouth. And out. Let's help you pop that on. Get proper service here, you see, when you come in. There we go. I think what we need to focus on is just this heart rhythm. If you don't mind, it would be good to have another ECG or heart recording now.
Yeah.
And I'm probably just going to have a word with the cardiologist because I'm wondering if we can just sort you out a bit sooner. And also another blood test. Is that all right?
Yeah.
So we're going to take a seat in the waiting room and they'll call you through into the treatment room. All
Yeah,
right,
for,
but we'll
for
sort
months,
you out.
for months and years, don't come here, and then suddenly.
Every 5 minutes.
That can happen. That's
Yeah.
all right, we'll get through.
Okay.
Come on through.
Thank you.
Once you've had the recording, if you still take a seat back,
Yeah.
and I'll talk to you at the end, okay?
Okay, yeah.
Lee Haskins, please. Have a seat.
Thank you.
Right, what can I do for you?
What it was, I got whiplash down my neck on Saturday.
Yep.
But it's done something to my arm and it's like on numb.
Right.
And I can't lift it to a certain level and it feels really weak. There's nothing there.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot. I can't remember if it was on maybe my face or something, but it's like whiplash my neck.
Different people have different terms for things, okay?
Yeah, of course.
So what do you understand by whiplash?
I just like put my neck, burn the sensation down my neck.
Right, okay.
I kind of can't twist it.
Can't twist it, okay. Well, how did you feel immediately afterwards?
I felt fine in myself,
Yeah.
just the burning sensation down my neck. I didn't even know there was something wrong with my arm until I got up and then I tried to kind of throw something back and then it was numb.
Have you taken any painkillers for it?
No, to nothing, no.
No, any particular reason?
Just thought I wanted to.
Just your hard.
Yeah.
Okay, fine. And have you had any injuries on your neck? Bad injuries before?
No, nothing before, no.
No, okay. And I can see bruising around there. Is that from the boxing?
From the fight, yeah.
Okay. Was it a good fight? Did you win?
I lost, but it was good. It was a very close fight, but this happened early in the fight, so if it didn't happen, I would have probably won the
Absolutely.
fight. Yeah, so
right, okay.
we're looking at a
Let's have a
rematch.
little look. Right, if you slip your hat
sorry.
off, what I'm going to do, and just see your neck movements, if that's all right. So move your head right back. Yeah.
Yep.
Chin onto your chest.
I feel that.
So you feel like, as in pain?
Yeah, a little bit of pain right there.
I've got a 65-year-old chap who's come in with, basically symptomatic with chest tightness for the last 3-4 days, which radiates to his jaw and neck area. He's feeling more tired, a bit more breathless when he does anything and when lying flat. And his ECG today, it's clearly keeps varying. It's 154 at the moment. Yeah, he's here in the GP surgery over at Hallfield, so I'll get an ambulance to transfer him over. Yeah, lovely. Thanks very much. Cheers. Bye-bye.
How have things been since we spoke on the phone?
Finally, that my headache receded on Saturday.
Good.
But even just moving my head, everything felt totally bruised inside. And this swelling that I've been getting for years now is beyond a joke.
Yeah.
When I got up first thing in that morning, my head was like a football, when normally it swells from here. My whole face, I was so shocked when I looked in the mirror, it wasn't like me at all.
Tell me what things you think have been ruled out with it.
They ruled out, well, they were concerned about meningitis and possibly a hemorrhage, you know, in the head.
But I think the headache has resolved now, so really it's the swelling issue that's the problem that you want to...
I've never had a headache like that in my life,
No.
ever. And I feel very, very unwell. I'm at the end
a
of
loss.
my...
So I confess that I don't know what it's caused by, and we have discussed it a number of times before. And I know that you've discussed it with specialists as well, and in particular the specialists that know you best, which is the rheumatologist, because of both of your rheumatological problems. And so I don't know what would be next, to be honest, and I am aware that sometimes when that's the story, very occasionally I've missed something, and so have all the other doctors, and there is something that can be sorted out, but quite often we just don't know, and we never will know, and...
It's making my life absolutely miserable.
Yes.
On top of fibromyalgia and arthritis and everything, every other condition.
Yeah. Then there's kind of just trying to manage the problem,
That's what I've been trying to do that for years. I mean, that's why I've come to a point now where I've tried everything I can think of, but I'm nowhere further along the line, except I'm actually worse with it.
Yeah. So the other thing that we have done is you take a water tablet.
Yes, every other day. Yeah.
Do you think on those days you're any better?
I actually think if I had them daily, I probably wouldn't have the problem of constantly going the entire wipe that day out. Yeah, I think that my body would balance better.
Well, I would be happy for you to try that out as a sort of trial of treatment, really.
Yeah, that's fine. And I don't want to stay on it if it doesn't work.
Because my feeling is that apart from moving your drugs around a bit to try and improve the problem, what I would like to be able to do is to try and make things easier for you.
Yes.
And that is, I think, our best option. How does that sound?
Yeah, that sounds sensible. There's one thing I wanted to ask you today.
Yeah.
I've been thinking about this for the last couple of years.
Yeah.
You know, I'm willing to take my medications and do whatever I can to make my life better.
Yeah.
However, I do not want to be resuscitated if anything should happen.
Right.
So could that be put on my notes?
Yes. So
I've spoken to my children about it.
OK. So that's an interesting question. So normally we would have that kind of discussion if somebody had a life-threatening condition or they were very frail, which you don't really have either of those things. So you are neither very frail nor have a life-threatening condition.
I certainly don't look frail, but...
no, I think, you really don't look frail. We have a form that we fill in for that kind of thing.
Yeah.
Where we write down that we've discussed it with you, that you have agreed that's what you want. And then, so what we do is we then use that form and send that off to the ambulance service so that they know not to resuscitate you, otherwise somebody will call and you will be resuscitated.
That's right.
And that form needs to be with you, so it stays in your home.
But it's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
Yeah, well, it's very difficult. The request for DNR, do not resuscitate, was unexpected. There are protocols that we go through to make sure that we're making the right decision, that the patient is able to make the decision, and if not, we would convene a best interest meeting. I think that Julie Dawn's able to make that decision herself. But in this particular case, I decided I would have a think about it myself and also talk to some colleagues. Just going back to the water tablet thing, you only get 28 tablets at a time.
Yes,
Shall I change that so that you can be on them daily?
Yes.
Yeah?
Yeah.
And put that on repeat. All right, well, let's hope that you're right about the water tablets.
Yeah, I hope so. It would be lovely to have a simple answer, wouldn't it?
OK.
Yeah, can but try.
Yes.
All right, thanks very much. Yeah, that'd be fine.
Fine.
Thanks ever so much.
That's all right. Bye now.
Bye-bye.
Hello. I've got an appointment at 10:20. I can't remember who it's with.
So it's Dr. McLaren.
That's it. I can't remember the name.
No problem. We can always find it. OK, take a seat then.
I got my own, thanks.
How many times do we say that? Habit.
Right, OK. Arms now. If you hold my hands, squeeze them really tight. Really tight, as tight as you can. Hurt me.
Sure.
Yep, absolutely. Okay. I'm hard. That's it. Pull me towards you. Pull me really hard. Good. Push me away.
Yeah, that's where I don't feel
that's not working, is it?
No.
No. Right, OK. Just relax. I'm just going to check your reflexes, OK? Right, OK. I'm just going to touch you with my finger, like that, OK? If we roll these back up, if that's all right. So you shut your eyes and say yes each time you feel me touch you.
Yeah. Yep. Yep. Yes. Yep.
So you can't feel there, can you?
Yeah, no, that's a bit...
So that feels different?
Yeah, this feels a lot different.
So can you show me where it feels different?
Just like down this line?
Yeah. Right. So I think you've done something that's caused a problem with the nerve going into that shoulder, down that arm, and causing the power problem. It's probably in your neck.
Yeah.
I'm a little bit concerned about that. OK, fine. You can pop your T-shirt back on. So I'll refer you for an urgent MRI, OK?
OK.
If things get worse, please come and see us sooner. So if the power reduces even further, the numbness spreads, the range of movement of your neck, shoulder gets worse, come sooner.
OK, brilliant.
Is that all right?
Yes, no
but you
problem.
can take painkillers.
Is there eventually at any point I can get like a letter to send to my manager?
Saying what?
Well, because we wanted to send it to the board that I had problems with my arm, so we maybe get a rematch and stuff like that.
OK.
So.
You'd have to request a letter, and there would be a charge for it.
Yeah, that'd be fine,
So you could do that via reception, OK?
Reception, yeah. OK, no problem, thank you.
No
Cheers,
problem.
Doc. Appreciate it.
OK, bye-bye.
Do I just get a letter?
You'll get something in the post,
okay, thank you.
All right, bye-bye.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
OK. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, OK.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the type
pressures.
of work, You get some sad cases in and affects you more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
There's plenty of people to talk to and things like that. I think that's the main thing, is to talk about it, because you're involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen it on our intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really, for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine. Yeah. Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
your face is all right, isn't it?
It's
Backs of the
normally
knees? Or?
No, I was hoping to give blood next week, but I don't think they're going to let me now, so...
OK. So I'm going to just do a prescription of Hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong, potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone, which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. OK, so the eczema we'll get on top of, but longer term, we need you in the NHS for a long, 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 long time.
Yeah.
So I need to look after you. OK.
Thank you very much.
That's all right.
Great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
Bye.
Young Zhao?
Yeah. This way, James. Come on.
Hello. That's a very cool hairstyle. Look at that. That's brilliant.
Right.
Right, I'm Lizzie. I'm one of the urgent care clinicians.
Yeah.
How can I help you?
Yeah, the right hand nasal hasn't been feeling well for a couple of months so far.
Couple of months?
Yeah, at the beginning I had the cold, but the cold is after the cold's gone.
Do you want to have a seat?
Yeah, I just it feels like, you know, every time you have a sneeze. But recently when I lower my head or just knee down, pick up something from the ground, it's a bit sore.
Painful when you
painful. Just
have you ever had any problems with polyps at all, with any growths inside your nose?
I constantly had blocked nose when I was a little, and then they gave me treatment by putting some patches along my ears, but.
So since a couple of months ago when you had a cold, what is it, just this sensation that's just never gone away?
No. It's not gone, it's getting a bit worse. It takes longer to get that feeling gone.
Let's have a feel of your sinuses. Do you have any pain And I press around here at all?
No, I'm
No.
No.
Any pain here or here at all?
No.
No. And what about over your eyebrows?
No.
No. Okay. Right, let's just have a look up your nose. You're full of energy, aren't you?
Yeah. Always. Always.
Just pop your head back for me. That might be big. Right, if you just slide down on the chair and put your head back there, let's have a look up your nostril. All right, I can't see anything obvious in there.
That's good.
I can't see any large polyps, like large growths or anything like that. I think we could try a nasal spray.
That was that was I'm coming for probably.
That was what you were thinking, to try something like that?
Try something like that, just to see whether it
works. If we
works.
give that a go and see if that helps.
Yeah.
If it doesn't make any difference at all, don't go in there.
No.
Just come back around this way.
You see more stickers on that. Yeah. So, quiet, please.
So 1 spray in each nostril twice a day.
Okay.
Try that every day. If the sensation gets any worse or you get any other symptoms, come back sooner.
Lovely, thanks very much.
All right.
Thank you very much for your help. Thank you. Thank you, doctor. Yeah. Let's
Bye.
go. Bye.
Paul Michelle, please. Paul Michelle. Oh, there you are. Hello. Hi, you come along.
Okay.
It says lumps on head on the screen, is that right?
Yes.
Okay, tell me about the lumps on your head.
Well, I think I probably have mentioned them in the past.
Okay.
But it just seems to me they're getting bigger. And
Okay.
3 independent witnesses have told me they're getting bigger.
Okay.
I can't tell.
Yeah.
And they're a bit flaky.
Yeah.
They frighten the grandchildren.
Oh, right, okay.
And I suppose I'd like you to wave a magic wand and make them go away, but failing that, some reassurance, I think.
Yeah. What do you worry it might be?
Well, skin cancer.
Okay, let's have a look at that. So do you think this is enlarged?
Well, I'm not the best person to ask because I can't see. But, you know, for example, my dentist that I've been going to for years, you get back, flat in the dentist chair, and he said, they're getting bigger, you know. And then my barber said, they're getting bigger, you know.
Yeah. But this one isn't in the way of the hair, is it? He says unkindly.
Sorry, this was what?
I said this one's not in the way of any hair.
Well, no, I mean, that's increasingly the case.
I can't speak, can I? This one here, I feel confident is something called a seborrheic wart.
That's caused by a virus, is that?
No, I don't know what causes it, to be honest.
Oh,
It's not caused by a virus. It's the one thing that isn't caused by a virus. I'm not sure what you would call that. It doesn't have any malignant features. Okay.
Right.
So these 2 dramatic things that scare the grandchildren.
Yeah.
Okay. I think they're both benign.
Yeah.
I'm 99% sure they're both benign. I think probably we shouldn't be doing anything with them, but let's get some pictures taken of them and just get their reassurance on that. Is that all right?
Well, as I say, I think reassurance would be
And if the dermatologist
something.
is unhappy with them, we'll get someone to take a biopsy or to even to remove them.
Yeah, okay.
The pictures thing gets sent off to the dermatologist. The dermatologist usually responds very quickly once it's been. So you might wait a bit for the appointment to have the pictures done, but normally within, 3 days, we've got a reply back saying this is what you need to do about it.
Yeah. Well, OK, that's
OK, is that all right?
Yeah.
So you could wear a hat, I suppose, not to scare the grandchildren.
Well, I do wear a hat on a sunny day like this. Does you think that makes any difference? I mean, is it I don't think it makes any difference to those, but it's good advice generally, isn't it, when you haven't got much hair up top. So if you go and book that with Kay in the treatment room, let's give it a week after you've had the pictures taken and then phone me and discuss what they've said about it. OK, yeah, that's fine.
OK?
Yes, thank you.
Super. Cheers then. Bye, then.
Hi, how are you doing?
Yeah, I'm all right.
Good.
So it was just because I'm thinking might try for another baby some point in a few months later in the year, and wanting to come off the sertraline and just kind of make a plan for that. So.
Yeah, OK. How's everything been going from that side of things?
Yeah, good. I mean, I think I'm just a bit of an anxious person, but yeah.
Well, that's all right. But actually, things have been quite calm and settled in the last little while.
Well, we both changed job and moved house.
Right. So with
in January and
all
February,
things considered, because
yeah,
that's a stressful time, isn't it, if you do all of that
Yeah,
stuff?
but we've just had a holiday. And,
Yeah. I mean, you're looking very well for it, you know. So
thank
that's
you.
good. And you're thinking about another baby, so that's exciting.
Yeah, not immediately.
Have you done any reading about sertraline and the risks of being pregnant with it? Or?
No, I just presumed I would come off it.
Yeah, I mean, generally that's the right thing to do. There are some risks of, rare risks of the baby not forming properly if you conceive on sertraline, although that's a rare thing. And of course, if people are so ill that with the mental illnesses, you know, anxiety or depression, that they need the pills, then the risk would be greater to stop them rather than to conceive on and off them. So it's a bit of a balance, is I suppose what I'm saying. And I think for you, if everything's going really well, then this is an ideal opportunity for us to think about cutting it down, because actually, anyway, if you're going to have a baby or not, we should be cutting it if you don't need it, isn't it? So, do you think that you're going to be all right on cutting down? Do you have any worries about that?
No, I think a bit of a wait and see.
Yeah.
The only thing is I've missed a couple of days here and there, and I felt a bit off, queasing, like more physically.
Okay,
but then I figure we'll do it slowly.
Sure, and I think that would be the main thing to say about coming off it, is that people do really notice when they come off them. And that's fine. It's common and normal to get some side effects as you reduce, but it just means that we need to do it really slowly.
Yes.
And so sort of over 4 weeks as a minimum, and sometimes even stretch it out even longer. And what you can do is either just miss out a dose and then take one the next day, or you can just take half a tablet as a way of reducing. Does that sound okay?
Yeah, that's
Do you need any more today?
I've got
to get you through
box, I think.
Okay.
So.
Because that one box is a month, and so actually that will give you plenty of tablets then to be able to do that.
Yeah.
Does that sound like a reasonable
Yeah,
step for
that's
that?
absolutely fine.
I probably don't need to see you again unless there's any problems.
No, I'll make an appointment if I need to.
Great.
Yeah,
I think that's the thing.
fine.
Or if it gets really bad, just give me a ring.
Yeah.
Or just go back to the dose that you were feeling fine on, because actually then you can just cut it down even more slowly.
Okay.
All right?
Thank
Good
you.
luck. Fingers crossed. And
Thanks.
I look forward to seeing you
All
as and when.
right, take care.
Bye then. Nice to see you.
Come on in, have a seat. I'm Dr. Graham.
I've got an existing injury. I had a spinal injury in 2008. And I have a weak arm.
Yeah.
But today, all day, I've had really bad pins and needles, and I felt really tight and uncomfortable, and it's just making me feel really anxious with it, which is probably not helping.
Yeah. What was the injury that you had?
C5-6.
Right.
So I've had an operation. I've had nuts and bolts in there. So now and again I will wake up with pins and needles, and when I'm working it too hard I get pins and needles.
Right.
But it's been constant today, and it's been really nagging.
Yeah.
And it just doesn't feel right.
Yeah. And what do you think might be going on?
Part of me thinks maybe a trapped nerve or something. I've been feeling it in my leg a bit.
Right.
I'm not in screaming agony.
Yeah.
It's all numbness. I was struggling to hold a pen. You know, I could hold it, but not for long.
Yeah. And when you had the surgery before, had you had an accident that caused that, or was it?
Yeah, I fell onto my head.
Right.
So I crushed the nerve, and it crushed between the discs. So the discs have come out. I was paralysed neck down.
What's on your mind this morning?
Right, I've got a history of osteomyelitis in my right ankle. A couple of days ago, I had a bit of a temperature and quite a bad headache. And I woke up this morning and I've got real bad pain on the inside of my right leg and sort of from the groin to the knee.
OK, you've got a history of spina bifida and you've got this problem with the right foot.
Yep.
There's a combination of orthopaedics and plastic surgery.
Yep.
Spina bifida is a condition that occurs in utero, in other words, when you're pregnant. It's a problem with the development of the spinal cord and its coverings. It can result in problems with muscle weakness as well as fluid around the brain.
This is quite sore down here as well, where I've got the muscle graft.
Okay, and I'm going to just pop you behind the curtain here.
Yep.
I just want to have a listen to your chest and have a look at the leg. So, is it all right to call you Carl?
Yeah, of course it is.
She says, having called you Carl all morning. Oh, there we go. All right. Carl has a significant past history of osteomyelitis. This is a very serious condition whereby you can get an infection in the bone. We also have to bear in mind that Carl has metalwork in his leg, and this is a foreign body. If that gets infected, it can be threatening to the limb in the sense that he could lose that limb. Okay, and there's pain in the groin, isn't there?
Yeah.
Does it hurt when I touch?
Yes.
Okay, can you push up against my hands? Good, and on this side. Good. Okay, I'll let you get dressed. Take your time.
Okay.
Is it stopping you from doing anything?
Not really stopping me doing anything. It's just when I walk, it's just gets a bit painful.
There's no signs of any infection.
Okay.
I think it would be a good idea to run a blood test this morning because we'll get the result fairly quickly. It may be worth just reviewing you back next week.
Okay.
And sooner if things haven't settled or if they're getting worse.
Yeah, all right.
Because of your past history, we're just extra cautious.
Yeah.
But often these things turn out to be just a muscular something or another in view of your
Hopefully it
general
will be.
orthopaedic history, you know? Things that would check you over.
Okay. Thank you
All
very
right,
much.
that's not a problem. Take care.
Okay, all right. Thank you very much.
Bye-bye.
Thank you. Bye-bye.
You got that.
Well, you would, being a City fan.
All right, so I think you might be right that the disc may have come out again to a very much smaller degree, and it's pressing on some nerves.
Right.
Okay, so you probably know this, but you know you've got your bones in your neck,
Yeah.
all the way down your spine, and in between you've got glue-like stuff, which is called disc, and your nerves come out.
Yeah.
And a little bit of that has come out and is pressing on the nerve, and it's sending the wrong messages down, so the kind of numbness messages, but also pain. Normally, it goes back in again on its own. Do you see what I mean? Okay. But this time, it's staying out for a bit longer than you're used to.
Right.
Does that make sense?
Yeah.
The question is what we do next, okay? Yeah. So the first thing is to think about some pain relief. And the second thing is to think about whether we want to just give it a few days and see if it just gets better on its own, okay? And if it doesn't, then we'll probably do another head scan to see what's happening.
Would that be like an MRI?
Yes. But I'm not saying you need that yet. You know, we know...
I'm reassured that it's something connected with what I've already...
I think it's most likely to be
Yeah.
exactly the same as what you had before. Obviously not the whole neck down, okay?
Yeah.
No, painkiller-wise...
I'm not in a massive amount of pain.
Okay. So the kinds of things that would worry me and make me think we need to see you sooner would be if you were to get any problems with your bowels or your bladder, you know, losing control of either of them, you know, because that is a worry because it's affecting the nerves that control your bowel and bladder, and that is an emergency, really.
Okay.
Okay?
Thank you for the reassurance.
Okay,
Much
good.
appreciated.
That's
lovely.
all right.
Thank you. I'll go and carry on.
Okay, bye now.
Cheers, bye-bye.
Cameron? Okay, hi. Right, let's just bring up a chair. Do you want to sit in that one and Mummy can sit in that one?
Because this is for you, not me.
This is for you. This is something to do with his ears, I gather. Is that
Yes,
right? Yeah.
yeah.
Just fill me in.
He had a perforated eardrum.
This is when he saw Lizzie Harris recently.
Yes,
yeah?
yes.
Okay. And how's he been since then?
Good, really good. We just want to make sure, because he's not been swimming for a while and he normally does that on Tuesday.
The ear was discharging, is that right? Yeah. Has it stopped discharging
Yeah, yeah.
now? How's his hearing, do you think?
Good. Back to normal, I think.
Is it?
Yeah.
Okay, well, that all sounds good. All right. Okay, let's have a look. So it was the right ear that was the bad one, wasn't it? And the left ear, Lizzie said, was normal? Yeah, okay. Can I look in your left ear first? Look at that one, your good one first. Look at that. Okay. All right, so that is a normal ear canal, normal ear drum, no holes or anything. We wouldn't expect it. If I press there, does it hurt?
No.
If I press there, does it hurt?
No.
Good. Very sure about that. Okay, I'm just going to take slightly longer over this one. No, everything looks intact, actually. The eardrum is marvellous at healing itself in the majority of cases. So it looks normal, OK? There's definitely no hole in that.
Oh, wow.
A nice sort of shiny eardrum and no inflammation or anything. So, yeah, you can go back to swimming.
Yay.
Yeah. And I'm surprised you say that his hearing's completely back to normal, because it often takes a little bit longer than this, but if it is, it is. So that's great. So, yeah, no restrictions, really.
Lovely.
OK. All right. That was quick, wasn't there?
Yeah.
Good. OK.
Thank you.
Cheerio, then.
Thank you.
All right, well done holding the door open for Mum. It's like a trap. It's like an assault course. OK, cheerio then. Bye-bye. Bye, Cameron.
Well done.
Bye-bye now.
Bye. Bye-bye, boys. Say bye.
Sarah, jeans, please.
I've got this
All right.
on my leg.
Yeah.
Now, this is the third or fourth time it's come up. I've had steroid cream.
Uh-huh.
I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it
Or
did
does
do.
it not?
Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK.
No. Just returning that key. Wonderful. If I could ask you to put that straight on one of the top first 4 hooks, that would be very gratefully received. Thank you very much indeed. Pleasure doing business with you.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here?
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right. So you've got COPD.
Yeah.
Yep. And any other... You've got diabetes.
Well, they think I have, but they think it might be to do with... because I'm on so many steroids.
Right. OK, well, we'll talk about that in a minute. And then... So you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike. And he's actually going to do a check of your heart disease, your diabetes, and your COPD.
Shall I bring a packed lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, OK? So I'm your doctor, and we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
OK, then, thank you.
Good. Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. OK, bye now.
Thank you.
Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
OK.
And of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? Well, they cause skin infections really commonly. They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done. All right, nice to see you. Yeah, no problem. Nice to see you. Bye.
Bye.
OK, that's fine if you'd like to go to the upstairs waiting room.
OK, no problem.
Thank you. Hello, can I help?
Mr. Apatrasoe.
Yep.
I'm Dr. Lee. Come on down.
Expect to be from China.
Yes.
Or Jet Li or Bruce Lee.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, you know, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
I have, yeah.
Where have you come from?
My father from Belarus, my mother from Greece, from Athena. And I'm Danish resident. After the high school, I was a security officer from army. SWAT, you know, the special squad, you know, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
Tell me a bit about it.
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here. And 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect, no problem with this. The only thing what put me down, it's sinus. I have pain with sinus. I don't feel good.
No, and you're not taking any tablets or medicine?
Today I don't take it, nothing.
No, right. So is it here? Just right there?
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there.
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones are all right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you.
I'm just going to do your blood.
Go out.
Yeah, but it does make it very likely that your sinus is infected. So you have diagnosed yourself correctly, I'm sure. Okay. Relax a little, and I'll just see what this is going to be up to. It's 184 over 104.
Because of pain.
Do you think? Okay.
I'm pretty sure about this. Okay. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
yeah,
and then 1 every day for till you've used them up for a week. That should settle it down. You must now book an appointment for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope
welcome.
To see you in 3 weeks.
Come on in. Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing. It bled everywhere.
Bled?
Yeah, it was. I think it was a varicose vein on the surface of that.
Yeah.
I was washing up and it just bled everywhere.
So it was the bleeding that kept you in hospital?
It was the bleeding that kept me in hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the blood doctors?
Yeah, I'm getting one. I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
It's
the
all
big
covered
dressing?
up.
Let me not look now, because actually, as long as it's OK from your point of view, the nurses are going to look this afternoon. So if there's anything if I take the dressing down and it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of OK, but I'm kind of waiting to go down.
And was it depression that you suffered with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they get, other thoughts or other...
Yeah, I have been there.
More serious kinds of thoughts.
Yeah.
Has that drifted in, do you think?
Yeah, a little bit.
Mm.
Hello, can I help, sir? All right, can I help?
That's exactly why I'm here, hearing problem. You going up?
I know, absolutely.
Catherine Amesbury, please.
Oh, that's me. OK.
Hi. Come and have a seat.
Nice to meet you.
Right, OK, so we spoke on the phone beginning of June, didn't we, about your X-ray? Yes, OK. And how is your back?
Bad.
Right.
I've got a trapped nerve now. It's just constant pain. So I don't know. What did the X-ray show?
Well, it shows some wear and tear, but it also shows reduction of the disc height on a couple of levels. So it makes me a little concerned. Is there any thinning of the bones?
Well, I've got sciatica at the moment all the way down this leg, and my leg's actually not working properly.
Right, OK.
It's really strange. It's like it doesn't belong to me.
OK, can we have a little look?
Yeah.
Myself up on the bed. OK. And if you bend this, so try and pull your heel into your bottom. OK, and push it up to the ceiling. Good, OK. Against again. That's it, right?
That's the weak one. Can you see where it's wobbling?
I'll just check your reflexes. Yep. Good. Fantastic. OK, you can jump up for me. OK.
I had a riding injury in my very early 20s, and I displaced 2 vertebrae. And it never was quite the same after that.
Sure.
But regular osteopathy. I mean, I can go for 2 or 3 years without seeing her, and then I'll tweak it, and she'll get it right. But this time, I haven't known to get it right. So, yeah, I'm just frustrated because I can't live my life the way I normally live it.
Yeah.
My maternal grandmother had osteoporosis. She was bent double in her 70s. Right. But I have been on prescriptive calcium, vitamin D since my 40s because there was a risk.
So this graph shows us the green is essentially you don't need to do anything, OK? The yellow is we need to measure your bone density via a DEXA scan, and red, we need to just treat. Now, you are very much on the border.
I'd like to know then if I can.
Yeah, I agree. In terms of your pain and management at the moment, are you happy with what you're doing?
Yeah, I don't want any.
No. So we'll wait and see what DEXA shows. If you want some physio, just let me know.
Thank you.
All right, no problem.
Lovely
Nice to meet you. Yeah, you
Thank
too.
you ever so much.
OK.
Let me just check. You haven't had any more suicidal...
Not since being at home.
...plans or hopes to die or anything getting so serious that it's got that bad? No.
Not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away, don't do anything, don't allow myself to eat, don't allow myself to go to the toilet, nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot.
That's a common reaction or way of dealing with it.
and a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot. Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem. So it sounds, I mean, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to look at your, see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in sixth form, so when I was 17.
Yeah. So you've been on and off it for your mood for 6, 8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect.
Yeah.
And starting off slow and building up is a sensible thing, because then there's less to come off later.
Okay.
Do you want me to organise some counselling for you or give you the details about that? Because that's one of the other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
I will do. Awesome. Thank
you
very
nice
much.
to see you. Bye then.
Bye-bye.
Hello, reception.
Hello, I need to make 3 appointments.
Hello, come on in.
Suffering terrible with migraines. Been suffering for about 6 years. I did get a preventative topiramate.
Okay.
It worked, but it stopped working now, so I've just given up taking it. I just thought it's best to come in and see you.
Yeah, have a chat about it. How often are you getting them at the moment?
I can get 5 a week sometimes.
Describe them for me, just
So I go funny in the eyes, and the head feels like it's being, and it's all pain in the neck as well. Just like a pressure building up, and then you feel like you're sort of slurry talking and things. So it's just strange how they just come on all of a sudden. The Imigram tablets are really great when you get an attack, but they do make you feel a bit... But they're brilliant for when they are needed.
So they're quite effective.
Yeah, amazing.
Yeah.
I just wondered if there was any other type.
Yeah. The answer to your question is yes, there are other things we can try. There are actually quite a few different preventative treatments for migraines.
Okay.
So we often try beta blockers, which were originally designed as blood pressure medication.
Okay.
But we use them for migraine treatment. They very occasionally drop people's blood pressure a little bit, and that can make you feel a little bit dizzy the first time you take it, while your body's adjusting to it. So we'd often try one that's twice a day.
Oh, twice a day.
Initially, I'll give you a month's worth as a kind of trial.
Okay.
If you find that it's not really the answer, give me a ring or come and see me again.
Yeah, it's easier to find sometimes, isn't it? Thank you very much for your help.
Great to meet you.
Nice to meet you as well.
Hello, can I help?
Hi there, it's Dan from Speechwrite. I've got an 11 o'clock with Guy.
With?
Guy.
Glyn.
Glyn, is it? Oh, they put Guy. Sorry, Glyn.
Leave me. The scarf though.
Just get a frank and begin.
I'll probably be still sat here.
Probably.
Okay.
If you're not.
Sean Priest, please.
Oh, here we go. That's me. Brilliant. Hey, can you guess what it is yet?
Oh, mate.
Oh, yeah, definitely. Yeah.
Right, I'm Lizzie.
Hi.
What's been happening?
So Tuesday of last week, I had a motorbike accident, collision with another vehicle. Fortunately,
Car?
yeah, well, Volvo, so, you know, might as well have been a tank. Yeah. So I was thrown clear of it, landed on the verge, but I took all the impact on my hip. I managed to sort of bounce off the side of it and do a bit of a Superman impression.
Through the air.
Into the verge on the other side of the road. basically I can't sleep. That's one of the main issues because of the pain. Also, I've got some concerns. The blood from the bruise is beginning to spread. It's spread around my sort of lower back, down my leg. It's spread across my groin and into other areas.
Right.
Yeah.
Okay.
Yeah. So that's kind of a bit interesting there. So.
Okay. Can we have a look?
Yeah.
All right.
Sure.
See how bad it is.
Yeah. No problems. I'm unhappy to mention it is affecting my sex life, as if having a smashed up hip alone wouldn't.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
When you say it's affecting your sex life,
It's spread into my testicles and pretty much halfway up.
meaning that it's painful or you can't get an erection? Or...
No, I'm functional, but it's tender, very tender, yeah. So, yeah, if I could figure out how to manage that, that would be nice. Or just an idea of how long this is going to go on for.
Right, so, okay, pull your pants up.
Yep.
Come and have a seat again. So, the amount of bruising that you've got,
Yeah.
I'm not surprised at. I wouldn't be overly concerned about it. Given the mechanism of injury, if we've come away that lightly, it's probably only down to the fact that you're quite muscly and you've got muscle to protect all of your bones and everything.
And muscle the bruises easily.
Yeah. You've obviously caused so much damage underneath your skin on the hip here.
Yeah.
It's filled to a capacity and then it's not really had anywhere else to go, so it has spread round the other sides a little bit.
Yeah.
Have you noticed it carrying on, spreading further? Or
It's reached the back of my leg just today. It was about here before, but this morning it's sort of down there. It seems every time I wake up, it's in new and exciting areas.
If at any point it looks like your circulation is changing at all, if this lower leg starts going a bit of a funny colour, if you start to lose some of the sensation or anything like that, need to see you straight away and probably send you up to the hospital. In terms of what you can do to try and reduce it, the only thing that you can really try is just to ice it.
Is there anything I can do for the sort of pain management side of it and sleep?
Paracetamol, 2 tablets, 3 times a day during the day, and then your 2 cocodamol at night.
Okay. Are there any kind of maybe almost like home remedies I can use to sort of try and disperse some of this blood, or?
Just gentle. You could try a gentle massage.
I'm talking about one specific area.
Not like deep tissue. Oh right, okay.
Yeah, it's not pleasant, and there
really isn't very much that you can do.
Okay, I'm happy to try deep tissue massage on the area.
I was thinking of your leg.
Brilliant.
I would just give it a rest if I was you. Yeah. Just give the whole area, just give it a rest.
Right, okay.
If it's hurting, it's trying to tell you, give it up. Just stop for a bit.
Okay. Put it on the back burner.
Yeah.
Brilliant.
Abigail Lee. You can walk like that.
I can walk and feed.
Well, I'm Dr. Lee, so that's very good.
Yeah.
We share a name.
Appropriate, isn't it?
Hooray. So is this a girl or a boy?
A boy.
Oh, very nice. And is it your first or not? How? So today, starting with you, how was it?
What, the birth?
Yes.
It went as well as such a thing does.
Yes.
Basically.
It's quite an experience, isn't it?
Yeah, and we had a home water birth. And that went really, really well.
Ooh, did you?
Yeah.
For a first baby, that's very good.
Yeah, it went. Yeah, it was. Well, I won't say it was good exactly, but it went well. I didn't use anything, and yeah.
Well, it's very unusual to actually manage your first at home.
Yeah.
Did you tear or have stitches?
I did tear and I did have stitches. Yeah, I had a 2nd-degree tear.
How is it? Has that healed up quite well or not?
Yeah, I think so. I mean, I don't feel anything anymore. I guess I'm not sure when it sort of. Oh, thanks for that. I'm not sure when it stopped hurting. Really, it did hurt for a lot longer than I expected it to. I have to say.
So, would you like me to have a look, or
I think
if
I'm
it
all right,
feels
to be
fine
honest.
to you, it's never quite the same. As
Yeah.
It used to be. But as long as it's not too tight, really, that's the thing. Occasionally, people get sewn up and they're just a bit wonky or tight, and that often settles down. And
That's all right.
sex? Have you had sex yet?
Who wants to have sex 6 weeks after giving so much?
And did you have any other problems in the pregnancy that I should know about?
My left outer thigh went numb, went about 20 weeks, and it's still numb now. And I assumed after I gave birth, I thought, oh, it will just go away, but it hasn't.
Which bit of it's on the outer border there?
Starts about here, goes down to about here.
Are you all right?
Yeah,
of course. Take him over here. You can just lie him on you.
Do you think you could hold him just for a sec? So I leak really badly, and I've got these breast shells. It's a bit embarrassing, and I frequently do that as well.
Well, I'm having to practice because my first grandchild's coming soon. So
oh wow! Congratulations!
I know. So this is kind of fabulous.
Just up here,
like that, and then if you take him.
Yeah. Hello, little one. Ooh.
Okay, that's great. So here's a bit of cotton wool. And I'm just touching your other leg with that. Can you feel that?
Yeah. Yeah. Yeah.
And how does it feel? Is it?
It's really hard to describe because it isn't.
It's less.
Yeah, it's just less. That's the only way I can think to describe it.
Now, I'm not going to hurt you with this, but I'm just going to... It's a pinprick.
Yeah. Yeah. It's very, very slight, though.
The good thing is the sensation is actually there.
Yeah.
Get that back up. I'll come and help you in a sec.
Thanks.
So the sensation is there. That nerve has obviously been probably bruised at some stage. I think it's a matter of waiting. The nerve is working because you can feel pinprick, you can feel different kind of sensations there. And although it's a bit dull, it will slowly come back.
That makes
Sit
sense.
tight, it will almost certainly just slowly recover.
Hi, I've run out of my pills. I don't know if I need to make an appointment with the nurse or can I just get a prescription?
Contraception.
Yeah.
A nurse appointment every time you need a prescription.
Oh, is it now? Oh, I thought it was every, 6 months or something.
Hello there.
All right.
Come along. So I think Dr. Pitt arranged for you to come and see me, is that right?
Yeah.
And prior to that, you'd seen a physiotherapist who thought that it might be useful for you to have an injection. Yes. And they've written in the note that they think you've got something called trochanteric bursitis, which is a inflammation in the layers over the hip joint. Yeah. On which side is that? Is
on the left.
Left side. Yeah. Can you show me where the pain is?
I'll stand up and show you.
Yeah.
There.
Yeah, let me just have a feel down here. If I hit a sore spot,
yes,
that's it there, is it?
Yes.
Oh,
yes.
sorry. Okay. Well, that is over what we call the greater trochanter, so that would fit with this. So what Dr. Pitt suggested was that maybe we put a steroid injection into that spot. So you're happy to go ahead with that on that proviso? Okay.
Give me back my legs.
Sorry?
Give me back my legs.
Well, don't have too high a hope, really. My hope with this is that we will relieve the tenderness at that sore spot.
It's worth a try.
It's worth a try. So I'll need you to get up on the couch. What we've got here is some steroid with local anaesthetic in with it. Any problems after this injection, particularly if you feel that it's inflamed or you've got a fever, do get back in touch with us. Okay. Now, I'm going to need you to lie on your side. I'm just going to mark the point. So next thing you feel will be a slight prick as we put the needle in, OK? I'll need to put it... Is that OK? Not too sore? OK, that's done. All right?
Is it? Is it done?
Yeah, it's done.
That's incredible.
OK, stick that on there. Good, we're done. All right? Do you want a hand down? Are you OK? Sorted?
Thank you very much.
All right. But we might do it again if it does work and it wears off.
It doesn't feel like anything's different.
No, well, it won't work immediately.
Oh,
Give it a
OK,
bit of time.
thank you.
Give it a bit of time. OK, then.
Chris Collins, please. Morning.
Morning, Doctor. Thank you.
Hi, have a seat.
Well, basically, the big reason I came in is for the results. Are they, for the scans? And they took me into the ring thing, that you go in.
OK.
Yeah.
Let me just have a little look. I'll just get up those results. Well, the good news is that the scan is normal, and if you get more blood in the pee in the future, then we should send you back there. But at the moment, that's all that we need to do.
Right.
So that sounds like all pretty good, doesn't it?
Yeah.
And how's your mental health at the moment? How's that all going?
Oh, not too bad. I've been moments when I sort of talk to myself a bit. Not answering myself, but...
Has that been stable in the background, or is that...
Yeah.
Yeah.
There is some times when, and I got, he comes from the Greenway Centre, and I talked to him about it, that sometimes I'll look at someone driving past when I'm on the bus and think there's someone I know, like, you know, and it's just trick of the mind, you know.
Sure.
But I think I have, at the station, actually seen a poltergeist, you know.
Right, Maddie, do you want to sit over there? Rio, you can come over here.
OK. How can I help?
So Rio suffers nosebleeds quite severely.
Yeah.
Through the weekend, he had 4. 2 were very, very bad, really struggled to stop them. I pinch it up here, it then goes down his throat.
Yeah.
And he spits it out. So I literally have to just wait for it to start congealing in his nostril. Yeah. He cries with them as well. I don't know whether or not they're hurting him.
Yeah.
Since then, he's been very lethargic, very pale. I don't know whether or not he could get anemic from it. I have no idea.
How long did they last for?
So the first one he had, that lasted maybe 2 or 3 minutes. And then a couple of hours later, about 7 or 8 minutes. That was quite a heavy one. But then the last one, the third one, which was sort of in the middle of the night, that was quite severe. It was about 10 minutes. Okay. And we're going through like
show me, Rio, show me what Mum does. Show me where Mum puts the pinching. Up the top there. OK. So you need to pinch much lower down. OK? So that bit there is a bit solid. You can feel it's a bit solid, yep. Whereas where it's actually bleeding from, almost certainly, is just inside. So what you need to do... Is it always that side? Yeah.
That side,
so if you had a cut on your knee, what would you do?
Why?
What would you do if you had a cut on his knee? Yes, so you go like that. So to put pressure on the nose, in that bit of the nose, you have to pinch the lowest bit, OK? But mainly it'll just make a scab, and that's what you need, is you want a scab, OK? So can I have a quick look up your nose? So if you just look up at the ceiling, very gently. And he's definitely got quite a good scab there now, OK? So the important thing is not to touch it at all, OK? It's quite common nosebleeds in the summer. Because the blood vessels get bigger anyway. Okay. What I would recommend is actually pinching for 10 minutes.
OK.
So the bleeding time should be 10 minutes or less. So by the end of 10 minutes, it should have formed a really nice scab.
Yeah.
And then it just needs to be left alone. Are you happy with that? And, you know, you're nearly at the age where you might be able to do this pinching stuff yourself, to be honest. Yeah? Rather than Mum doing it. Yeah? Nah. Is that all right?
That's great. Thank you so much.
You look very well.
Thank you very much. Getting there.
All right.
Come on then, kids.
All right, kids.
Thank you.
That's OK.
Bye.
Bye now. Bye, Rio.
Well, I know that in the past you've had problems with, you know, ideas that have been difficult to explain, haven't you? And delusions that are linked to your mental health problem.
Yeah. One stage, a car went... This is a long time ago now. Car went past, and do you know Data out of the Star Trek: The Next Generation, the robot? I swore I saw him in the car, which was quite funny.
The mind does play tricks on people, doesn't it?
Yeah, and I actually, I do actually see them. You know, I do actually see... It's not as though there's a blank space and I imagine something. I actually see something through my eyes, which is...
And that's what, you know, when people talk about hallucinations, that's what they're like. You know, they're really there for people.
Yeah.
That's a really good description. So it's certainly not... Nobody's saying that you're not seeing it. It's just that that's part of the mental health issue, we think. Hallucinations are part of a group of disorders called psychotic illnesses, schizophrenia being probably the most common of these. For some patients with chronic psychosis, they don't have the insight that means that they can see the hallucinations and delusions that they're suffering are not real. And this adds huge challenges, you can appreciate, to how we can support them and treat them. Fortunately, Chris is in a good place at the moment, and his medication is controlling those symptoms, and his hallucinations are something that he recognises, and so currently he has good insight into his mental health problems and how they're affecting him. We'll carry on with you being supported by the mental health team at the Greenway Centre.
OK.
And then I'll see you probably in 2 or 3 months if everything's going well. Super job. Well, nice to see you.
OK, Doctor.
Till next time.
All right.
Bye.
Bye.
Good morning. Have you date of birth?
23rd August.
It's next week, my lovely. What date? You did it online. 12th, next Wednesday. Exactly the right time, but a week early.
Kirsty Winskill, please.
I like your doll. Oh, thank you. Right, I'm Lizzie. I'm one of the urgent care clinicians. How can I help you?
We'll go with a throat infection. This morning my throat is bright red. My voice is gone. It's very painful.
Yeah.
I've got a friend's wedding to go to tomorrow.
Oh, no. No singing for you. Is it a church wedding?
No, manor house.
Stand at the back, I just had to mime. Right, OK. Do you think you've had a fever at all?
Hard to tell, I feel hot. But
Yeah, it's pretty hot. Yeah. Not felt freezing cold, though?
No.
No, good. Have you been taking any painkillers at all?
Not yet today.
OK. So your temperature's normal, 37.2. That's good. Let's have a look in your throat, then. Stick your tongue out for me. Nice big ah. So it's quite red. Your tonsils don't look... Yeah, your tonsils don't look too bad. Let's have a feel of your throat here. Is this sore?
There, yeah.
All over. Quick look in your ears. Have a stand up for me a second. OK, turn around. Let's have a look in this one. OK, so your ear canals are a bit red, both of them, and your eardrums look absolutely fine. So I think it's probably a viral sore throat. There's no pus on your tonsils. Your temperature's normal, which is good. With tonsillitis, there's 2 types. There's viral and bacterial. Viral is just really annoying. We can't do anything about it. It's just a case of just waiting and painkillers. I think are you off today, or have you got to go to work?
In work.
So just a case of rest as much as you can tonight, early night, painkillers, paracetamol, ibuprofen with your food, and the throat spray if you want to get some of that from the pharmacy. Okay. Loads of water, and try and avoid alcohol tomorrow. But other than that, have a fabulous weekend.
Try to.
All right.
Thank you very much.
See you later. Bye.
There's a lovely handbag here. Take care.
Thanks very much.
Bye-bye. Thanks.
Tidy up for her. Tidy up.
Don't worry. I'll do
OK,
it.
thank you. Bye-bye.
OK.
Thanks.
Bye-bye. Tidy up.
Tidy up now.
Ratman? Yeah, OK, brilliant. Oh, I lost 4.5 pounds at Slimming World.
Well done.
Don't look at the fridge now, then. No. OK, bye-bye.